Hello and good evening. Thank you for having me. It's actually a pleasure and a delight. Love talking about innovation and love talking about influencing young minds and future entrepreneur and leaders. The topic I'm going to kind of put in a framework of what's the business of healthcare in a larger scale and how do we do this today, taking care of people. People ask me all the time, what do you do? And I say, I'm in the business of taking care of people. And what is it that people want? What are their needs? How do we come up with finding better ways to do what we need to do? And you see, we are all patients from the time we are born till we leave this planet. We need healthcare all the time. And in this paradigm, healthcare in the U.S. is a $3.5 to $4 trillion economy, and still we don't have some of the best outcomes, etc. And that perhaps needs a change of paradigm, needs innovation, etc. So I'm going to talk a little bit about leadership and management in the world of healthcare, present my views and thoughts on this, and kind of try and give you a flavor for how the future, as I see it, is coming along. And I've been fortunate enough to do this at multiple levels. Uh, Being a solo practitioner, being a tenured associate professor, I've chaired large departments, done small ones, but also been very entrepreneurial and started and managed a series of companies. But it's the foundational principle has been how do I take care of people? We call it enlightened healthcare now, where we try to do things minimally invasive, but take care of the human being, not just the procedure, not just the technical thing that we want. We call it patient centricity. You'll see the hospitals and health organizations that'll get focused on a technology, they'll get focused on a procedure, they focus on something else, but the center of gravity is not the patient. But once we switch the center of gravity to the patient, life changes tremendously. Now, I founded MIMIT Health, which is the Midwest Institute for Minimally Invasive Therapies, back in 2003. We've re engineered and reinvented ourselves a bunch of times, always keeping the patient in the center of our existence. And the core is when we talk about truly being holistic and truly being patient centered, and not just in words, but actually taking care of how people feel. That's the spirit, how they think, the mind, and the body. And it goes from all the way. So, what's our aim as human beings? We all guess on this planet. Nobody's left this planet alive permanently, and it's a one-way street. It's, when we are born, in my mind, the universe says welcome to consciousness, but we'll give you two sentences. It says you will die one day. That's your death sentence. And at the same token, you are now imprisoned for life, your life, in this mind and this body until you die. Now do your best. The laws of nature are fixed, the paradigms are fixed, and how do you add value and what do you do in this framework? Now, as we live today, and this is when I'm talking to you folks who are a class of future entrepreneurs and talk about innovation, we live in the outcome. We're all addicted to Amazon, Costco's, we love technology, Elon Musk. All of these are designed to give you a great experience and you live your best life. But what does that mean? What it has done is asked consumers to first be very, very informed. The second is very proactive, very curious, very demanding, very cost conscious at the same time, and very discerning. Uh, Everybody's on a mobile device. Everybody's trying to do something. And if you look at Amazon, it's everywhere, all around the globe. I call it the Amazonification of healthcare now. Amazonification itself has become ubiquitous everywhere else. And all age groups are embracing it, not just the young millennials, but all the way to the octogenarians. Now, what do? We take pride in saying that we provide patient centered, connected, and collaborative care within an Amazonification paradigm. To me, that's how do I do this better? How do I do it faster? And how do I do it cheaper? And to do that, what we started to do a few years ago was take the best of practice systems across all industries and then bring that into our paradigm and provide care and a truly holistic, all encompassing approach. I mean, I make my patients meditate because that's where we feel. If you're fearful, you can't heal. So we go, I said, from meditation to artificial intelligence, we use a ton of tools, etc., that uses all the new innovative technologies, AI, etc., to meet that outcome or to obtain that outcome. In the end, the core is that the patients trust us to help them lead their best lives. Now we know that consumers in business don't go looking for a new mousetrap for the sake of it. They want to get rid of mice. The same way, we all as humans, as patients, are not looking for a fancy procedure or something else like that. We want to be healthy and live to the best of our potential. To me, success is fulfilling your God given potential. And one of the core things is to get the right information to the right person at the right time to make the right decisions, all for the right reasons and rewards. We've actually spun out a management company and a management service organization called Sims. I founded this. And what it does is puts all these platforms together, and we've built a platform that can provide virtual care from start to finish, from the very first time somebody has a problem and wants to reach out to us till we have analytics and everything else. Now, if you buy from from Amazon, you're most likely a Prime member. You go to Costco, you're a member. It means they know you. They are centered around you, and it is these platforms that allow us to connect with the patient and go on to the next level of providing the service. At a higher level, this is the way I look at it. There is a paradigm for success as humans, but definitely in healthcare. And we talk about B2B, business to business, business to consumer, but everything is human to human. When you're ill, you don't go to a building for care. You want to go to another human being. They just happen to be in a building and an organization. So at the very core is understanding the human condition. Then after that, we take on the role of becoming a physician, where we're going to help another human being heal and be at ease. When you're not at homeostasis, at ease, that's where the word dis-ease comes from. And finally, no human being, no physician has ever healed anything ever. The body heals itself. That's the way nature works. After we become basic physicians, we then move on to the next level of becoming specialists. Then we move on to being subspecialists, and we hyper focus on one thing. Now, I do a lot of focused work in certain areas of the body, but it's attached to the human being. It's attached to his mind, his body, and his spirit. And the patient then has to be at the core and the center of all of that. So in clinical practice and academic centers, wherever we are, the success comes from at the very base of the pyramid, making sure you practice the state of the art. Then you can teach the state of the art. It's education. Then you say, how do I enhance the state of the art? How do I make this better? That is research. This all requires leadership, and the customer is at the very top. That's our patient. Unfortunately, I've seen this for a long time now, where a lot of organizations are self-centered. They want to be leaders. They consider themselves leaders. They want to talk about doing a lot of research, and they say we are an education institute, and the clinical practice is some of the worst. And patients don't have a good experience. It's very hard for them, and that obviously that organization is wobbly, and they don't succeed. In our world, one of our core things is to save limbs and prevent amputations. And we try to do this better. We try to do it faster. We try to do it cheaper. It's win-win for everybody all around. This is a gentleman who has, as you can see, a ischemic leg. Here's an angiogram that shows there's blockages in his arteries. This is in an outpatient setting where we've actually taken care of this without admission to a hospital, done this at 1/3 the cost, or 1/3 to half the cost of it being done in an expensive hospital, and made sure that the patient is back. So again, this has been a core platform. Now, the Amazonification effect is transferring everything from retail to finance and healthcare industry. It started with more millennials, but now you can't register your car or get a driver's license without having an email and texting. It's just ubiquitous, and now it's happening at all age groups. And that challenge requires immense innovation. So it's constantly saying, how do I do this better? And that's really, really rapidly coming into healthcare. Now, if you look at any world-class organization, you'll see these 6 pillars. The first is product excellence. You will see if you go to Costco, you go to Amazon, they'll give you an excellent product or service, whatever they're selling you. If for any reason you're not happy and it's not working out, they'll give you excellent customer service. They make sure you're satisfied as a customer. In these organizations, you'll never meet an unhappy customer-facing employee. They are fiscally responsible. What do I mean by that? That they make a profit, but they add value for you. They make sure that you are getting value as well. Finally, they are in a cycle of continuous improvement and innovation. And finally, they have systems that sustain this. And you can try this. Look at any world class company. Any world class company, this is what they're doing. Now, all these organizations put the customer at the center of their universe. That's what we've done with patients now. Now we say, how do we attract these patients? How do I know everything there is to know about them? Now, how do I take care of them? And then from there, how do I engage them and keep them engaged? We've adopted a system where, just like flight paths are complex, there are a bunch of different factors that can hit it, and no flight anywhere in the world without a control tower knowing. Similarly, we have care coordination, we track patient journeys, and we make sure that no patient on their path through their care, whether it's acute, intense, immediate, or a long-term chronic condition, that their care is coordinated and being taken care of. Now, one of the things we've learned is focus on the community, but think global, act local, which means we take the best that we can find in other places and bring them into our world. And taking care of patients is not an easy. Right in the middle is your patient. That's the core, the truth. But you have to have a relationship with physicians. You need to know everything you can about the patient, et cetera, et cetera. And there is a lot of information. And you will see in large organizations, while even as your students or practicing medicine, it is when the information cannot be passed on that it becomes a challenge. And all the successful organizations today, the biggest innovation has been digital transformation, which we'll talk about in a second. So as we made this patient-centered, so our paradigm is the following. First, if you are not kind, you cannot care. If you are not caring, you shouldn't be in healthcare. And we are invested in the patient's success. We want them to lead their best life. When they have a problem, they come to us. The goal is solve that problem. Therefore, now with that in mind, we want to connect with that patient. So we can connect with them on all channels, text, email, live chat, you name it, we can do that. Then after that, we collaborate as a team to make sure we are focused on that patient for the success. And that is the core foundation of how we go about this. And you can see there are so many aspects that come into taking care of this, of any human being, from whether it's how you get the patient in, all the different business applications that have to happen in addition to the clinical. We've been able to get it all on one platform and get our way working through this. And we track the patient through their journey. We track the physicians who are referring them as well through their journey, and make sure that we know all there is to know about it, but keeping one thing in mind: patient success. So for example, if patients may not know that this service is available, so we market to patients, referring physicians, managing the network, managing contact centers, managing the case. We see patients wherever they are, which means they could be at home, they could be in a hospital, they could be in a clinic, they could be in a nursing home, they could be in a skilled facility, and we manage to make sure that we have engaged them through their journey no matter where they are, and work our way through that. And one of the core factors that's needed is get the right information at the right time to the right person to make the right decision. And that brings us to a core innovative aspect in healthcare. And that's really digital transformation. It's not about just technology. It's not about a new or fancier system. It's about really transforming what can you do with data and the information that comes from it. So let's go back here one second. Data is the new oil. So you see, if you have oil and you just have technology that's a spark, all you're going to have is an explosion. Now you take oil and you put it in a combustion engine. That's the technology. You have the process and you have the people to manage it, and you have powerful engines, rockets, everything else. It's the same with data. People get data, they have the technology and the process. When it's all put together, this becomes really powerful. And what that really requires first is data is just discrete element. You say, I know the height of Mount Everest. But what does that mean? So you take that and you process that a little bit, and you get a geological characteristics of Mount Everest. It's just information. You've just processed the data. Now you get to know this report. You have that knowledge, but still, what are you going to do with it? Wisdom is, why am I going to do this? It's the same with the traffic light. Data says there's a green light or a red light and orange light. Information says I know that this is a traffic light. Knowledge, stop at this traffic light. Wisdom is, why should I stop at this traffic light? Because if I don't, I could have an accident, I could hurt somebody. The other way to think of it is you have discrete elements of data, you collate, curate it, it becomes information. You understand it, you internalize it, becomes knowledge. And once you get to the why, it becomes wisdom, and that's what we call actionable insights that come in. And in your environment, wherever you are, as you work this, first is all this data has to get collated, so there's data systems. But data just sitting in a system does not make sense. You have to democratize the data to make sure that the entire organization can get it where they need it. People need to understand how to be literate with that data, be able to analyze it, who is accountable, and finally, what should I do with this data? And data, it's an important thing to know, and especially this, call it the 7 V's. First is very high volume, high variety, high velocity, means it's coming in really fast. Veracity, variability, visualization, and finally value. They say these are the 7 V's of data, so to speak. Now, I'm sure you run into reports and get in, and people have done analytics, and they give you a report and say, what happened? Well, this is what happened, whatever that may be. The next question is, why did it happen? That is diagnostic analytics. But then you can start predicting now what will happen. That is predictive analytics. And finally, prescriptive analytics. Given Alexa, all the sensors that we have, I track my heart rate, sleep, all these with sensors that we have, all this being tracked into apps and the analytics and everything else. It's not far away that there will be a scenario where a person gets a call saying, based on all the data we've collected, you have a high probability of having a myocardial infarction, and we're actually sending an ambulance and getting you in preemptively to make sure, and that is prescriptive analytics. We're seeing that in many different aspects. For example, somebody is a diabetic, they're monitoring their blood sugar, or somebody's hypertensive. We do drug adherence. We have sensors that when the patient takes their pill, they can press on it. It notifies us, monitors their blood pressure, remote patient monitoring, and then say, hey, the patient didn't take the meds, the pressure is up, or this person's going to go into the ER with some kind of crisis. Let's go and intervene, and that's the actionable insight. So we've taken existing, and we've got a very high tech stack, which means all the different solutions out there. I don't do any coding. Nobody on my team really does any. It's not that kind of development work. It's not the technology. It's really taking that information and how can we consume it, digest it, and come up with the right thing. So the digital transformation journey, and this is very important to understand. First is digitization. You have a piece of paper, you make it into a digital format, whether it's a picture, a PDF, or whatever that is. You've just taken an analog information and made it digital. Now that doesn't add too much insight. The second is the process of technology, such as we have an EMR, or you have some tool that is a electronic system, and that we call digitalization. But the true value comes from digital transformation, where the effects of all the prior technologies are making sure that this leads to the success of our stakeholders, in our case, patients. And how do we take this? So we had challenges, as you see, in hospital environments and everywhere else. Patients are unhappy, their experience is not good. Starting from how do I get to the hospital, where do I park, what do you do? They have to navigate all these complex systems, etc., and they're all dissatisfied. They don't have communication with their staff, with the physician, with the staff, etc. Operational insufficiencies, employees burning out trying to keep up with it. Outcomes are suboptimal. Well, I didn't know they had this, and I did something else, and now we have a problem. And data is in all different kind of places, and obviously when there's so much inefficiencies, you start losing money. Once you get on this platform, just as Amazon will give you a package within a few hours, and you can track it all the way, and so do other companies do that, but it's all the logistics, and all of it is based on a foundation of digital transformation. Patient satisfaction goes up, operational efficiencies increase, your employees are more excited, your outcomes are better, systems are talking to each other, and obviously you're profitable at the same time. And what's important here is not to focus just on the digital tech, but actually focus on the data digital transformation is what insights can I get from that data? That is what becomes really, really important. And to understand that the velocity and especially change is the only constant. And we live in this era of the fourth industrial revolution where there's continuous learning and innovation all around. So, as we talked about some of this, we built a pretty sophisticated technology stack working our way, but again, all using what already existed out there. Now, I know some of you are going to be future entrepreneurs, etc. So I thought I'll talk a little bit about entrepreneurship here. So the word entrepreneur really comes down to one word in my mind, and that is how do you manage risk? But really, what it is somebody who takes on, organizes, operates a business, but really takes on greater than normal financial risk. You have an idea, you're going to try and drive your way through this. If you understand risk and can provide the leadership and management, that's when you know you're going to be really successful. It's important to understand human beings have feelings. You can move a desk around all day, a table around all day, but it doesn't care. But a human being, the minute you move them around a little bit and they feel bad, that's when you have a challenge. So you lead people and you manage things. That's a very, very important. And if you're a leader, you can't force them. People need to want to follow you. I say you got to be like the pipe piper. You play the flute and they will follow you. But now at some level, we are all in the human behavior or motivation business. You try to get people to get motivated, inspired, to get the best out of them. That could be the same for patients. You want them to lead their best lives. You want providers to be better, to make changes, and we are in this process of influencing people. So as you come up with, hey, what can I do better? What's the problem? How do I solve this? You keep this at the very core. So some of the basic principles of life, as I've learned this in a human approach, is first is that everything comes from nature. And the laws of nature govern everything. None of us decided when we would be born who would call us, our names. Our parents didn't decide. There's some higher power that does that, whatever you call it. Now, no one has left this planet alive. That means everybody has to go. It's a one-way street. It's a journey. But what's interesting is that everything man-made and or influenced by man is designed to meet human need. That's the perk of being high up on the food chain. And all humans need and want one of these four things. This is from the 7 Habits of Highly Effective People. It's kind of a compression of the Maslow's hierarchy of needs. It's live, love, learn, leave a legacy. Live is physical survival. Love is emotional survival. Learn is intellectual survival. And finally, leaving a legacy is our desire to be immortal. And so we want to leave a thing. And all of mankind has one mission: preserve life and make it better. Nobody goes and buys a car that's worse than last year. Nobody wants to eat food that makes them sick. We all want this, and this is a core human need of the human condition. And as we talked about, physical survival, so when a patient comes in and they have a problem, we say, how do we make them better? Unfortunately, a lot of our systems are designed to just make sure you treat the patient as if you're fixing a car, and you do a procedure and you don't care what the patient feels, what the experience is, etc. Love really is emotional survival. If you see all the songs are written about somebody loves me, doesn't love me, whatever that, it's really knowing that, hey, I feel cared for. It's a core human need. When those two are met, that's when we get into what you call intellectual survival. We start smelling things and trying to stimulate our senses, and whether it's art, whatever that may be. And finally, leave a legacy. Everybody wants their name in print. You've heard it's Rockefeller, Chase, all these people, JP Morgan, whatever. You see so many, you've never met them, Gandhi, but they all left a legacy which still impacts us and our lives on a daily basis. And we talked about this, and I'll repeat this again. First is whatever we do, we give an excellent product or service. We make sure that they're happy, customers. We make sure our employees are happy. We say, you want to treat your employee as you want them to treat your best customer. Fiscal responsibility means maintain profitability, but add value for the customer. Innovation means enhance the state of the art. How do I do this better? And finally, sustenance means we develop systems to make sure the first 5 are constantly moving forward. Another thing that we've adopted is this is from Michael Gerber. He wrote a book called The E-Myth. And really, he talks about 7 centers of management attention. At the core of everything is leadership. Leadership is about where you want to go. Management is about how you're going to get there. And as you start doing this, in this world, you start seeing of centered on the patient. How can I provide leadership in my organization? How can we innovate in this so that we are centered on the patient? Patient success is our core value. The next one is marketing. And marketing is not advertising. Marketing is understanding your market. If you are dealing with patients who are 80 plus years old, their needs are different from if you're dealing with pediatric patients. The second is understanding the flow of money. Just as in humans, blood flow is important. Same way, in any organization, any business, the flow of money is important, and how do you manage that? Then comes management, all the different systems that you need to manage whatever that may be. Then comes the aspect of how do I get potential customers, patients to come to us for a problem that we can solve. When they come in, once the first they hear of you, they call you, that's a lead. But once you convert them, they now become your customer. If they are with you for a long time and they're repeat customers, they become a client. That's where patient services are. And now we've gotten into population health. We've gotten into chronic care because we have a silver tsunami coming, and this is a global phenomenon as the population is aging. So that's kind of what we, is called the 7 centers. It just happens to be one paradigm that I've adopted to bring into our world. But the top part is the internal focus. How do I fix this inside? And the bottom part is the customer focus looking at. Now, we took this into our world. So let's talk a little bit about the healthcare business. We know our mission as physicians, as healthcare organizations, is to preserve life and make it better. We already talked about that. And as healthcare providers or in the healthcare space, we are going to care for another human being. And each one of us, from the time we are born, perhaps even before that, need healthcare till the time we are out of this consciousness. Medicine and surgery is how do we maintain health, etc. Medical imaging came about to start look into the human body, and finally image-guided interventions, which is what we do a lot of. So as I talked about, as core is leadership. Leadership is about headed in the right direction. That is true north. And you say and what's our vision? What are the values? What is it that we are looking? Is that where we want to go? Sometimes you can take shortcuts, but it'll usually land you in trouble. So the most important thing is to stay principled and stay with true north. These are core values that we talk about in MIMIT Healthcare. First is care. If you care, if you're kind, you can care. If you care, you're in healthcare. We are focused on patient success. Whatever their problem is, we want to solve them, give them a good experience. We collaborate as a team. We are constantly innovating. And the word Sangat means community. It's a Sanskrit word, and I was born in the Sikh faith, and it's core to our value where we take care of our community and we do service. But it's a funny slide that I always put together saying you really want to be aware of where you're going. Sometimes you're very eager to get out of the situation you are. So when you're innovating, sometimes you want to make sure you're in the right direction. Now, our mission is to deliver high quality, cost-effective healthcare through a comprehensive, integrated, multi-specialty group of healthcare providers. And our vision is we're going to use our skills and resources to help people in the communities we serve. Remember, I had a slide up there that said, think global, act local. And what do people want to do in the communities? They want to live healthy and happy lives. We add value to their lives by solving their health problems with the least cost and stress to the mind, body, and spirit, and definitely financial resources. And we believe that people are the foundational bedrock of any community, and that humans want to live a happy life. And then on that core basis, we go to the next thing. So as we talk about innovation, etc., you say, what's the current state? That's A. Where do I want to be? The future state? That's B. Strategy is how do I get from A to B? As you're innovating, as you get there, we say begin with the end in mind, and we start to work our way from there. Management is like, how do I get there now? It's all about execution. Execution is about getting it done. Management, execution, getting done. And if you have a strong vision, where do I want to go? You have a brilliant strategy and you have operational excellence, success is unbelievable. It's something we build. And it's also an important thing that an average strategy, well executed, is better than a brilliant strategy, poorly executed, especially as you're innovating. You stay focused on solving a problem. You say, you may have a brilliant strategy, but you can't get it done. It's useless, versus you may have an average strategy, but you can really get it done very well. The other core principle to follow is that systems produce outputs. That's why we have cardiovascular systems, solar system, traffic systems, air traffic systems, etc. But systems, you put an input into the system, it'll produce an output. And every system, no matter where it is, will need 6 right things. Let's take a sports paradigm. You cannot play basketball in a football arena, so you need the right structure. You want to have basketball players playing soccer or football, you need the right people. You can't play basketball with football rules. You need the right processes. You need to make the right decisions of where you're going to do, what you're going to do, but for that you need the right information, and that all this is done for the right rewards. The same thing applies to when you're doing surgery, you're taking care of human beings. You need the right structure. You'll need the right people, the right processes. You have to make the right decisions with the right informations, and all for the right reasons, the right rewards. And we talked about the pillars of success. As you notice, I repeat this a few times because innovation is core part of it. But remember, innovation for its own sake is not worth anything. Innovation to ultimately meet core human need is where it really comes down to. So we have taken and operationalized all of this, where as we do the surgeries, the data is collected. It's all structured data. All these data are talking to each sources are talking to each other. We do a lot of analytics. We report it to the people. We analyze it, whether that's trials, as this is innovating for the future, but getting the right information to everybody to start solving whatever problems we need to solve. We've been able to put business intelligence systems in there so that, again, the right person's getting the right information at the right time to do the right thing. And that becomes important, whether that's care coordination, and everybody at that level gets this. Now, once we had a challenge of patient satisfaction. A patient's upset, didn't get an appointment on time, they are late, or they didn't get their report, etc., etc. And then the outcomes become bad. If you don't have the report, you don't have the tools, you don't know what's going on, and then you lose money for that. That was a second challenge, was suboptimal clinical outcomes and financial outcomes. And finally, if you have those problems, you can't grow. And another important part of understanding businesses in general is that just like an infant, initially a small business will be, as a startup, is in infancy. As you expand, you're like a teenager, you grow, you develop systems, and finally organizations get into with very mature systems in place. We've been able to go through that transition from doing healthcare at a very entrepreneurial level. And we've taken, and we've had data now, and been able to show that be able to do complex peripheral arterial interventions, prevent amputations in an outpatient settings where the patient's getting better care, it's getting faster, and it's much cheaper, where the cost is half of that of a hospital. I always say you got to watch where you set your eyes on. You can get yourself killed. At the same time, make sure you don't get others into trouble, especially as we innovate, because we can get very excited with what we're doing. With that, I'll stop here, and I will look for questions and answers if anybody has any questions.
Thank you so much, Dr. Chopra, for the talk. I actually had a question about kind of how you were able to reduce the cost of, for example, the peripheral artery procedure that you mentioned earlier. How were you able to slash the cost by half without reducing quality of care?
Yeah, so the first thing was, the structure we talked about. Hospitals are very complex environments, and the rules and regulations are different. And there's so many regulations and so many processes that just didn't make sense, that add to that cost. So we took it out of that hospital environment, and we said, what's the best way to do this? And we built it into an office-based environment or an ambulatory surgery environment. And we were able to keep it very, very lean. and not just because of some regulation. So here's a question I ask people all the time: how many business students in the top business schools want to be the CEO of a hospital? Very few. So hospitals are not using the best state of the art principles and management's kind of systems, if you would. And there's a lot of waste. And that's how we've been able to do it. Bring it out, focus on the patient. For example, we can have I saw a patient today without being admitted to a hospital. Tomorrow morning will be have his procedure in 2.5 hours, 3 hours, he'll probably be home. Same patient in the hospital will come 6 hours earlier, will go through a rigmarole of stuff, a lot of paperwork, a lot of bureaucracy, will stay in the hospital, most likely overnight, then go home, and all the other complexities that go with it. I hope that makes sense for you.
Yeah, I actually had a follow-up question. Is that why we're seeing a lot more venture capital firms going
Yes,
into hospital healthcare systems and buying up and managing healthcare systems?
yes, absolutely, because they have realized that number one, healthcare in the U.S. is almost a $4 trillion economy, and you know, and that is larger than the entire GDP of Germany, of the Great Britain, and some of these countries. So that's a huge amount of money floating around, and still there's so much inefficiency. So think about it. You have a package that you order from Amazon. You can check it, track it, FedEx on your app, whatever. You have a problem, you click a button and you can connect with them. You take your ATM card or any your card, you can go anywhere in the world and plug it in or log in and you'll get all your information. Try doing that with your healthcare. You can't, healthcare information. But that is the opportunity that's out there. So now the business capital companies have realized there's a lot of opportunity in providing better care and cutting down the cost. The other thing was we all have iPhones, we have all these devices. Every year, every 6 months, actually, technology doubles, but the cost stays the same. So when they design for value. On the other hand, in healthcare, unfortunately, most of what is designed, even in industry, is done just to say, how can I get more money out of this? And it just keeps adding more and more cost. And that trend is changing now. I hope that made sense.
Dr. Chopra, I think there's a question in the Q&A.
Yes, I actually see. It says, why do hospitals, healthcare systems tend to be slower to adopt new technologies and structures? Think of an oil tanker and how long it would take for it to turn around. And that's part of the challenges with hospitals and hospital systems because they've slowly been patched up into these complex systems that are very hard to just turn on a dime. The other thing that I've seen is they're very scared of innovation for this, to just experiment, because when you experiment, you fail and you want to fail quickly and then learn and succeed. That is not encouraged in the healthcare system. And healthcare hospitals especially respond to two things. One is regulation, regulatory, some pressure, some a survey, something, and second is some cut in reimbursement or cost. And that's, I think, the challenge for that, the reason that happens.
Dr. Chopra, I have another question.
Yes, please.
So yeah, specifically in the field of interventional radiology, from what I've seen, it seems like the field's becoming more clinically based. It was sort of more of like a referral specialty in the past.
Yeah.
You sort of see clinicians sort of distancing themselves from large hospitals in the future? And then how do you kind of see this affecting patient care?
Oh, yeah. I think part of the challenge that hospitals have is over the years, hospitals and physicians have had a kind of semi-adversarial relationship, and there's a lot of distrust that has happened over the years. And if you look at when you bill Medicare, there's a professional bill and a technical bill, and et cetera, et cetera. And so there's always this tug of war between hospital systems and physicians. Now, obviously, people go to a physician for care, and with that challenge, that this is starting to now evolve. And interventional radiology, for example, grew out of radiology. And so they tended to be, hey, I'm a diagnostic radiologist. I can now stick a needle into this. So that has now changed to where, like any physician, you take care of the human being. We have 7 to 11 clinics, depending on what stage of development they are in. But that has changed completely. And we have realized as physicians that we don't want to be caught under a system and their prerogatives, especially if it's not patient centered. I hope that makes sense to you, because if you're not patient centered and just dealing with, oh, the patient has to stay in my network even though I don't have the capability because otherwise I will lose money, that's a problem.
Thank you.
I see another question. It says, how should government, insurance providers, or other stakeholders be involved in healthcare? How is this different than other industries? So you see, the challenge in healthcare is this concept of third party payer. You go to a restaurant, you pay, you eat, you pay them. That's one party, second party. In healthcare, because of risk management, insurance, we pool risk, and now Medicare is the largest insurance, which is federally backed. Then you have the large insurance company. They take money from their subscribers, and then they have to find a way to make a profit. You'll never see a broke pharma company or insurance company. And because this is such a large pool, that's where the challenge has been. But I tell you, there's a lot of innovation going around there, and especially now that the insurance companies are using tremendous systems and trying to manage populations, decrease the capability of them, or possibility of them going to a hospital and just getting unnecessary expensive care. But there still needs to be a lot of integration between insurers, providers of healthcare, and the other industries such as pharma and medical device. There's a lot of opportunity to synergize over there. I have another question that says, I was wondering if you could provide a more detailed example of the holistic care you provide an average patient. Here's a simple example. You see, when patients come in, they're afraid. And what happens is, we as humans, we suffer either our memories, that means something happened and I am afraid because that happened, or I'm going to suffer my imagination. I think something's going to happen, I'm going to get pain, and there. And I teach patients meditation, for example. It's simple: deep breath, hold it for a second, and then take it out slowly. What that does is stimulates your vagal nerve and your parasympathetic system, and it gets you to calm down. Try it yourself. I actually make patients meditate. We play music. I call it vocal anesthesia. That I've done maybe 2 to 3,000 vein procedures, and I've not used one drop of sedation ever on all those. But similarly, when you talk to the patient, when you get them to understand it, but then we use examples like meditation, but also diet, exercise. I get patients to get injections in their spine every day. There's somebody to send them for an epidural, but their muscles are weak. They're just, and I tell them, if you had a horse, would you let your horse sit around all day? What would you do? Make it exercise. So I say, the real you is your spirit. That's the real you, where you feel. Your body is your horse. So we teach them exercise. We do breath work, yoga. We are now setting up for employees and patients ways for them that they can participate in understanding these things and applying this, not in a hokey pokey way, but in their real lives. We have different body types. I always tell this jokingly, but have you ever seen a vegetarian tiger? Have you seen a horse eat meat? Those are the basic laws of nature. You understand that. You understand I have a certain body type. Listen to your body. Certain foods work for you, certain don't. That's what I mean by applying all. Holistic means applying everything. And from the high tech to the very low tech of meditation, understanding all this, and that's the effectiveness. That's how I call, and we do that literally on a day-to-day basis.
And Dr. Chopra. Yeah, sorry, go ahead.
Sorry, I just wanted to interrupt because my question is a follow-up on what you just talked about.
Okay.
My name is Ashkan. I'm one of the medical students here. Okay. I was wondering, you kind of were mentioning like prescribing meditation.
Yes.
Is that something that like, do other physicians like have any input or thoughts on that? Like, do you back it up with like evidence
Of course, there's
based
tons of,
medicine, or is it more of like anecdotal? I was just curious.
there's tons of and then the thing is, it's like there could be a 1% chance of something happening, but if it happens to you, it's 100%, right? So the same way, there's tons of data on this where they give it different names of how it has helped patients deal with situations better. There's a lot of data on that. But I've been doing this for years, and it's nothing about writing a fancy paper. It's about actually patients being happy. We have grandparents, parents, and their kids all in our practice over the last 20 years. And why? Because they feel good. In the end, we as humans feel before we think, and that's where it comes in. There are tons of papers on this, by the way, yeah, in terms of the effect of mindfulness. You can call it meditation. But the thing to remember is that it doesn't need to be hokey pokey and you're not sitting in some lotus pose doing something. It's simple, calming yourself, whether that's breath work, etc., going from there. If you connect with me, I'm happy to share some of that information with you.
Thank you.
Sure. I see another question says, physician training tends to be a long and fixed pathway. What are ways that we can get more clinicians to take risks, like engaging in entrepreneurship? People by nature are either risk takers or not. They're givers and takers, and some like risk, some don't like risk. And it's the kind that likes to take risks, but I am seeing, and there are large institutions and others that are encouraging folks to innovate and take risks. But some of that is happening just as if they're going to develop a new technique, a new device, versus innovating in how can I provide better care. And I think that a lot of institutions are starting to do that very early. I hope that answers the question for this attendee. Are there any other questions? Happy to answer them.
I've got one for you, Dr. Chopra, if that's okay.
Sure.
Yeah, so you mentioned how important data is to not only healthcare organizations, but to patients and providing better patient outcomes. Do you see it becoming a problem in the future with all this data, that data gets out to other businesses and people stealing data, and kind of the importance of keeping that data protected?
Absolutely. I mean, it's part of the human condition. We'll always have this challenge, but I think as a threat comes on, we find the right tools for security too. So data security is huge. That's why we have HIPAA laws and everything else. But think about it with Alexa. Now you could talk to Alexa and say, Alexa, call so and so for me. You'll do it, and a lot of Alexas will actually get you. Oh, my Alexa kicked in. Alexa off. So all this data, along with the sensors, will be collected. It's already happening.
You have several contacts named O. Can you please say the name exactly as it shows
Forgive
in the
me.
contact list?
I just need to.
I don't know that.
So yes, that is going to be a challenge, and all these different sensors and tools that we have, there's going to be more and more data that's not just kind of data that you input, but your blood pressure, your heart rate, your sensors. Right now, Google knows at any given time where you are. And even if your phone is off, as long as you haven't taken the battery out, when you turn it back on, it remembers all of it and puts it back up. We've already crossed that barrier, but security is extremely important, yes. I hope that answered your question, Brian.
Yeah, thank you. I think we have one more Q&A.
The question was, do patients ever come into the clinic not necessarily for an IR procedure, but for advice on how to be healthier individuals and live fuller lives? Absolutely. Absolutely. In fact, I don't call myself an IR all the time. I like to say I'm a good human being first, and then I'm a good physician. And then I start from there. I happen to have some skills. If you remember that pyramid I showed you, you get subspecialized on the top. And there are other people who do this as well. They just may have a different title as a surgeon or cardiologist or whatever. But absolutely, where I have patients who come to me for things I don't even treat, but then I tell them I'll find them somebody. And that is because when you connect with the human being at their core level, what I call the spiritual level, where they really feel and they trust you. And to trust, you need to be trustworthy. Once they trust you, then they come to you and ask you, how can I do this better? And if you give them good solution once and twice, then they know they trust you, they keep coming back. So I have a lot of those patients, yes. I hope that answered that question for them.
I guess one last question. How far away do you think we are from the Amazonification of healthcare, as you put it? Like, I understand that you're trying to get MIMIT Health to exemplify what you're advocating, but it probably is going to take some time for that to spread across.
I'm seeing this almost everywhere. Somebody or the other is doing it in different ways. EMR companies. One of the things Amazon does very well, it knows you, so it's connected in you. And that's why they do Prime. You can send stuff back, you can do whatever. They keep you happy, and the next thing they do is they execute very well, heavily into logistics. And I am seeing health systems and health businesses related to healthcare doing that more and more and more. And it's a journey. It's not that one day it'll be switched off. For example, now there are a lot of organizations where you can text and communicate with patients. There are a lot of tools that are coming in, what we call patient engagement and patient experience. So it's a journey, and then it'll be a matter of how fast this spreads to everybody, and there'll always be a gradient. But I think it won't be too long before just about becomes standard of care, so to speak, that you will text your provider. We even have it where once it's geolocated, so every patient we know have their mobile number, we have their email, and then we have SMS systems. If you have an appointment, we're setting it up where once they're geolocated in the building, we know they're around the area, they get a text message, et cetera, et cetera. So there's all these technologies that you consume outside of healthcare that are coming in, and this is being adopted by a lot of people across. But it's slow, but it's happening, and consumers are going to demand that, and that's I think it'll be within the decade, without a doubt.
Thank you.
Sure. Excellent. If there are any other questions, I'm happy to answer them. If not, folks who have registered, etc., I'm sure we have the email. We'll share the presentation. You can always reach me on LinkedIn and or via email, etc. So thank you again.
Thank you so much for your time.
Thank you. Pleasure.
All right. Thank you, Dr. Chopra. I appreciate it.
Thank you. Bye-bye.
All right. Take care.